Welcome, and thank you so much for joining us today. We're here to explore an often important and often overlooked topic, the connection between mental health, deafness, and hearing loss. My name is Jane Lee. I'm the National Director of Hearing Health at Deafness Forum Australia. At Deafness Forum, we work to make hearing health and well-being a national priority. We know that mental health and hearing loss are deeply interconnected and that people's experiences deserve to be heard and respected. Before we begin, quick housekeeping. This webinar will be recorded and will be available publicly. We have the following accessibility options. Auslan interpreters should be automatically viewable on your screen. Live captioning should be able to be turned on or off at any time to suit your needs. If you have any tech issues, put it in the Q&A and Peter, our IT, will manage. And we also want to say a note on language. Hearing loss and deafness exist on a broad spectrum, and that spectrum reflects a rich diversity of identities, communication preferences, and cultural experiences. Throughout today's conversation, you may hear terms like deaf, hard of hearing, and hearing loss used at times interchangeably. We use these terms with care and with the intention of being inclusive, but we absolutely recognize that each person's identity is valid, personal, and deeply deserves respect. Finally, we want to acknowledge that the link between mental health and hearing loss can be complex, sensitive, and deeply personal. If at any point you feel overwhelmed or need to take a moment for yourself, please do so. This is a space where we aim to prioritize kindness, safety, and choice. Before we begin, I'd like to acknowledge the traditional owners of the many lands we're joining from today. I'm joining from Ngunnawal and Ngambri country myself. I pay my respects to elders past and present and extend that respect to all First Nations people with us today. We also recognize and honor the knowledge and lived experiences of First Nations deaf and hard of hearing people and the cultural and community wisdom they bring to conversations about care and well-being. Today's webinar is more of a conversation than a presentation. Think of it as a fireside chat. We won't be using many slides, and we keep things informal, flexible, and grounded in real experience. So please feel free to settle in, grab a beverage of your choice, and whatever helps you feel comfortable. If you have a question at any point, pop it in the Q&A box. We'll aim to answer as many as we can during the session. So why are we here today? Around 3.6 million Australians live with some form of hearing loss. That is 1 in 6 people, and that number is expected to rise to 1 in 4 by 2050. Many of us here today may be deaf, hard of hearing, or experiencing hearing loss ourselves, or perhaps you support someone who is. While exact numbers of how many people with hearing loss are living with mental health concerns is not known, evidence consistently suggests that people with hearing loss are at a high rate of mental health challenges compared to the hearing population. As an example, a study of Australian adolescents aged 11 to 18 with hearing loss found a 39% prevalence of mental health conditions in comparison to 14% in their hearing peers. Another study found that individuals with hearing loss were 2.587 times more likely to develop psychiatric disorders than those without hearing loss. Earlier this year, we led research that also supported this link. Our research explored the experiences of those with hearing loss and mental health concerns navigating the health system. The findings showed that 42% had anxiety, 33% depression, 47% social isolation, 53% stress, and 2% said they had PTSD. And it was in response to this research that Macro Impact Consulting reached out to us, and this conversation came to light. With that, let's start the conversation. I'm so pleased to welcome my guests, Sigrid McDonald and Dr. Louise Monroe today. Sigrid, I'd love to start with you. Could you tell us a little bit about yourself and share something about your journey that's brought you to this space?
Hello, everyone. It's really lovely to be here. I'm thrilled to be part of this conversation. And thank you so much, Jane, for the introduction. So I'll talk a little bit about myself and then I'll hand over to Louise as well. So, who am I? I am a deaf neurodivergent mum of three coded children, and I live in regional New South Wales on the northern rivers of New South Wales on Bundjalung country. So, my background is an education in environmental sciences, and my work has mostly followed community services and arts leadership and cultural development. So, quite a range of different skills and disciplines overlapping in my work experience. I work with macro impact consulting, and I also work for Flow Festival as artistic director. And I work as an Access Collaboration Hub in the Access Collaboration Hub here in the Lismore area of northern New South Wales. So I work with the community in a range of different experiences, but the common theme is always working with community. And I've seen a repeated pattern of barriers to access and gaps that exist. It doesn't matter how long someone works at this, there are ongoing barriers and gaps. So, for example, access to services, access to everyday things that make life smooth and good for deaf people. So I work with Louise, and we are trying to fill those gaps and target the gaps around mental health specifically. So I'd like to ask now Louise to introduce herself, and then we'll continue on with the conversation.
Thank you, Sigrid. So my name's Louise Munro, and it's such a pleasure to be here today and have this conversation. I'm here in Brisbane on the Turrbal and Yagara lands, and my work currently is as a psychologist, and I work in a small private practice. Previously, I've worked as a lecturer in a university setting in counselling and psychology, and I also have a nursing background. So I've done a few different things, but it's just it's been a more recent development with Sigrid and I working together to develop macro impact consulting, and we really love the idea that we can work together and have this allyship approach, because in my work as a psychologist, I'm constantly coming up against other professionals who are hearing and just don't have any idea about the lived experience or the unique experiences that deaf and hard of hearing people have across the lifespan. And so working with Sigrid, we can share different perspectives, the perspective of someone who comes to the work with the lived experience of being deaf and having Auslan as a first language, and then the perspective of a hearing professional. And I guess sometimes both groups don't know what the other group doesn't know. So we've been able to share those perspectives and present as an allyship model.
Great. Thank you so much. So let's dive a little bit deeper into the conversation. So let's start talking about like unpacking more the connection between mental health and hearing and deafness that often goes unseen. So Sigrid, what's often misunderstood about deaf, hard of hearing communities in mental health contexts?
I think there's an extensive list, but really, as Louise mentioned before, people don't know what they don't know. So I feel sometimes people who work with the deaf and hard of hearing community or when they see the community or they see individual clients, their knowledge is quite surface level. It's not targeted and accurate. People like to try and use their current existing knowledge and just apply that to deaf and hard of hearing people, where in fact they'll need to adjust their lens. So, to give you an example of that, maybe someone has met a deaf or hard of hearing person before, and they make assumptions that all deaf and hard of hearing people will be the same as that one person they've met. And it takes a while to realize that there's a huge diversity within the deaf and hard of hearing community. I'm just one example of a deaf person. And there are so many other diverse representations of what it means to be deaf. And the depth of diversity sometimes surprises people. Hmm.
I don't think we can hear you,
Yeah,
Jane.
sorry, I went
Oh,
off
there we
mute.
go.
I'm back on mute now. So thank you so much for sharing that. And I think you're right that people don't always understand that there's such a rich sort of diversity in the deaf and hard of hearing community. In terms of when it comes to sort of mental health, though, what sort of things do you think that people don't really understand that, you know, when specifically around sort of mental health and its connection to deafness and hearing loss?
Yeah, I don't think people realize the link between deafness and mental health. It's not well understood at all. I have a lot of research and articles that say, yes, that link does exist with hearing loss or deafness and mental health. But the broader community and the professional community in clinical settings aren't aware of this information. There's lots of assumptions that it's just focused on the ear, the hearing loss, without understanding the impacts on other areas of our lives and how much we embody that, and it can impact someone's life and their identity and their everyday experience to be deaf or hard of hearing. So the depth and breadth of that experience is also not well understood.
Yeah, and can you talk about those ways that are understood, maybe ways that aren't really obvious and visible to people? So for those who are maybe supporting somebody with deafness or hearing loss, what do you think they maybe aren't seeing about the way that it's impacting their mental health?
Yeah, the invisible things, again, there's so many. I think sometimes it's not well understood by professionals how much work a deaf person has already done before they come to that clinical setting. So there's all of this background work, like booking the interpreter or researching to find information because perhaps the information available isn't in an accessible language, or trying to find an appropriate service, thinking about captions because maybe they aren't an Auslan user but they still need language support or other types of support. Maybe they're working really hard on listening or lip reading, and there's a lot of fatigue there. There's so many layers before you actually sit down in an appointment with that professional. And Louise, when you first started working with the deaf and hard of hearing community, I'm sure that you felt like it was a big learning curve and realizations that it was more than what you first thought, right?
Yeah, absolutely. I think, Sigrid, when you first spoke about that sort of surface level understanding, which is that someone can't hear something to some extent, there's so much more depth under that. And one of the ways that I make sense of it myself is by looking at some of the differences between the impacts on people with prelingual deafness and those with the postlingual deafness, and then what's shared between those groups, because there's a lot of difference, but there's also a lot of shared experiences. So the difference between someone who's born deaf and may or may not have access to a fully developed and rich language environment.
Oh, I think that we have lost Louise momentarily. I'm sure she'll join back now. Oh, there we are. We've got Louise, but we can't hear you.
There we go.
Thanks, Louise. And you were talking a little bit about the difference between the
Yeah.
prelingual and postlingual deafness and supporting.
Yeah. So I think when, as a mental health clinician, I think the first question is what contributes to our mental health experience in life, and its identity and its self-esteem and its stress and its trauma. And that's common to everyone in the world. But people with a hearing loss, to a various extent and at different stages in life, experience quite unique stressors, traumas, and even how and why the hearing loss might have happened, if that's related to illness or related to an inherited genetic familial line. Those things have different impacts. So moving from that surface level of this person can't access audio to what are the really complicated impacts of that.
Yeah, so can you unpack that a little bit more and
Mhm.
perhaps also talk about, I suppose, the ways in which people who are supporting those with hearing loss can better be more supportive and more trauma informed as well because of all the complexities of it?
Yeah, so I think the idea that coming from the hearing world, we make assumptions that we're not even aware of. So the first thing I would say is to believe the person. So when they say, I missed that or I didn't get that, we need to acknowledge that and actually work to deliver the information. Often people get tired of repeating things, or people get tired of asking things. So patience is really important. Understanding that access to information is part of our social cohesion in life. So, simple things like being at a dinner party or a gathering and not being able to hear the joke or missing something, and people saying, oh, I'll tell you later, oh, that wasn't important. Life is rich and full when we can laugh and share with people, and not just know the emergency details that someone else thinks is all we need. So connecting with people's lived experience, really understanding how important it is
Mhm.
to be included in conversations in families and social settings.
Yeah,
That's
thank you.
just one thing that families and support people can do.
Yeah, that social inclusion is so very important. Secret, from your experience when it comes to that social inclusion, in what ways do you think people who have friends, colleagues, supports have done it well, and how can people do it well in supporting you with social inclusion and just being supportive?
Yeah, I think really at the base level, it's about trusting and believing the deaf person's experience and validating that, having respect for their communication in that environment and acknowledging the power dynamics that exist between hearing people and those with hearing loss, and a willingness to be open to doing the work to work on that power dynamic and meet someone where they are.
Right. And so
And
one of the things,
understanding, yeah, it's a common experience in the deaf world It's very important and very common compared to deaf and hard of hearing culture. We face a lot of barriers compared to the mainstream. So, yeah, if hearing people can accept and be open to learning our experience and open to adjusting the way that they communicate to accommodate that deaf and hard of hearing person, because we are already doing a lot of adjustments ourselves. So if we can be met halfway or more, and that's something that we do in our education, is to try to bring in different perspectives from a range of community members and areas of the community, not just one deaf experience, but to show a variety of experiences and perspectives, because there's a lot of information out there that can help us to ensure that there is representation from deaf and hard of hearing perspectives, that whole range. And that's globally as well, not just in Australia, because some of the experiences overseas are very similar in the family environment, in the medical settings, education. There are a lot of common barriers that exist for deaf and hard of hearing people around the world. It's not unique just to the local level. And it's a well-known barrier that the deaf community know of, that we would love for the broader community to be aware of. And the more you are open to understanding that, the easier and smoother it is to make progress from there.
Yeah, and it is exhausting because we hear from our community too that hearing fatigue is it's real, it's exhausting. You do have to work extra harder to be involved and be an active participant in a conversation or in a social setting. And so communication is sort of an obvious barrier that comes up a lot, just that, sometimes providers sort of think that they will just get an Auslan interpreter and that will solve all the problems. But there's more than that, because not everybody does Auslan, not everybody lips reads. There's such a diversity. So you talked a bit about cultural stuff. Can you unpack just a little bit about, because we hear a lot about cultural competence as well and being culturally supportive. Can you unpack a little bit about what it means to have culturally safe and linguistically accessible care and why it is essential?
Yeah, so it's essential because I'm trying to think of how to word this. A lot of feedback from many deaf or hard of hearing people who meet with mental health or general medical services, time and time again, they will say, I have to educate the professional. They'll question me about my deafness, but I'm not there for that. I'm not there to educate them. I have a particular issue that I need support with. But again and again, we see people say that they need to take on that responsibility of education for the medical professional or mental health professional about being deaf and hard of hearing before they can get the care they need. So in order to change that, we have to think about what cultural safe services look like. And that can be different for individuals, absolutely. But it's about thinking more about whose job it is to educate, who does that work. The hearing professionals will have different levels of knowledge, as will the deaf professionals working in their area have different levels of knowledge, as well as their lived experience. And lived experience is really important as well, because they'll be able to share a different amount of cultural safety compared to someone who has never related to the deaf community at all. There are some people who aren't deaf who are hearing, but they work with the community. And nevertheless, that doesn't mean that they can't improve on their cultural safety and cultural competency. So about those deaf lenses and applying that to your work. So for example, a GP doctor might understand that I don't understand their experience. So the GP will also need to think, okay, I don't understand my deaf patient's experience, but I will try and consider a deaf lens or a hard of hearing lens and adjust the interaction accordingly. It's not about perfection, but it is about being willing to acknowledge and recognize that you might not know everything about their needs as yet, but making the effort to adapt to fit them.
Yeah, and so good you say perfection, because I think a lot of people do worry about, if I don't do it perfect or if I make all these mistakes, but it is really about a willingness to learn, having that not just culture safety, but that culture humility, that ability to just kind of reflect and learn and look at the ways they can be more safe as well. Um, have there been occasions where you think a provider or maybe like a friend or like any sort of person around you has done it right, that they've actually demonstrated that they're willing to learn and provide sort of a safe and linguistically accessible environment for you?
Yeah, I have for sure. I could say with people who are open and want to meet my needs, and they're more intentional. Maybe they will look themselves for information. They take that extra time to prepare and take the time to make me feel safe. And yeah, I've had plenty of experience where sometimes they know someone who is deaf and hard of hearing. They already know the community, and so they've taken on that load to be culturally safe themselves. Sometimes I will look for their prior experience. Maybe they've been part of the community or they're part of the community now, or I can see that they have worked with other diverse communities or specifically with the deaf community. So I am aware that they may have tried to find the best fit for deaf and hard of hearing people. If I feel that a professional is willing to learn, I feel like that increases the chance that it'll be a positive experience.
Jane, I'm not sure if you can see. I just wanted to jump in there with something that Sigrid was saying, and also connect it to your point, Jane, about cultural humility. Um, I think some of the language we use is about ticking boxes. Are we culturally affirmative? Yes, no. Whereas cultural humility is about continuing to reflect and make changes and be open to what can be done differently. And the research in mental health overwhelmingly says that the therapeutic relationship is what makes the biggest difference. And in this area, we can't rely on an evidence base because the evidence base is we just don't have enough research. The deaf and hard of hearing people have been excluded from most of the studies because they're not the group that the research is trying to capture information from. So we don't have a strong evidence base for individual interventions and what works, but we do have a really strong evidence base that the therapeutic relationship makes the biggest difference. So again, when we started today, Jane, you spoke about kindness, safety, and choice. And I wrote them down because I think they're really key components to what constitutes a safe therapeutic relationship as well. Um, and just a quick example, I spoke with a medical professional recently who said, "Oh, I see you've got this webinar happening. You know, what is this about deaf people and mental health? Is it because they can't access the information?" And I was thinking that's the subtle bit that needs to be turned around. It's because you can't deliver the information because you're not being part of the bridge in understanding those lived experiences and the subtleties of what it's like to have a lifetime of exhaustion, exclusion. So yeah, when we talk about what works, I think cultural humility, focusing on the therapeutic relationship, taking extra time, being patient, believing people's stories.
Thank you, Louise. And as a practitioner, in what ways have you been able to sort of build that therapeutic relationship?
And again, I know that we have an audience today right across, you know, the experience range from deaf and using sign language to hard of hearing, people who may or may not use assistive devices. I think the thing that I have found most helps me connect with the people I see is understanding what's important to them and what is most problematic for them. So that also means having an understanding of Auslan, home sign, signed variations and the different registers that are used, having an understanding of what the impact of accessing language has on the developmental brain. That's been really helpful. But also understanding how assistive devices work and why people choose to use them or not use them. And really, again, it's about educating myself so I'm coming to the conversation with some foundational knowledge that I'm then inviting the person I'm working with to add to, change, correct. Yeah, that's what I've found most useful in building those therapeutic relationships with clients.
Thank you. Sigrid, I know you talked about how you often have to do all the education and all of the hard work, and that is exhausting and that's tiring. And so I sort of hate to sort of ask this, but I know there's probably people out there who say, you know, I have hearing loss, I have deafness, I'm struggling with my mental health, I need to get support. How do I go in and get that support in such an exhausting environment where I have to constantly educate and talk and how can I do this in a way that um, is more safe for me so it doesn't make my mental health worse? Because so from your experience, how can how can someone become a bit more, I don't know if the right word is resilient, but just in sort of trying to get the support they need, knowing already that there's already a disproportionate burden on them having to do the work already. So I recognize that. But if you okay to share that, that would be great. Thank you.
Yeah, I think there's probably two layers to that. So on the bigger picture, it's what's happening out there, the people that are working to improve the understanding and educate and advocate and provide information about deaf and hard of hearing culture and the intersection with deaf and hard of hearing experience and other lived experiences. For example, mental health or medical or educational experiences, because there are great organizations and groups doing work out there. So finding what that connection is, what is out there already, what you have in your area, what targeted services there are for deaf and hard of hearing people, but at the same time knowing that there are a lot of areas that either have no services at all or very few services. So it's great to research within your community who the allies are, who in your community can be a good ally, and getting those connections happening in the health spaces and in other areas of a support team, so family and socially in your network, finding who the good allies are and then linking in with their networks as well. Find out who already has some knowledge and understanding of deaf and hard of hearing needs and build those relationships. I think, yes, for professionals, you need to give time for that relationship to happen and that rapport to develop. I think, yeah, when we talk about it's not a perfect or ideal situation, having so many barriers and gaps. But if you give time for that rapport to build and you find the right relationship and the right experience, maybe you're looking for someone with lived experience or the right attitude professionally. And when I say right, maybe that's not the best word, but because it's not about right or wrong, but
Right.
yeah, a willingness to do the work and meet their needs. And also to bridge those two cultures and needs. So deaf people, hard of hearing people are over on one side and professionals are on the other, whether who is expected to go all the way or whether you meet in the middle or somewhere along the path, finding the appropriate place for both parties to feel able to invest and go forward.
Thank you.
Yeah, I think that was maybe a little bit of a rambling answer.
Thank you. So I want to go back to the comment before about how it doesn't have to be perfect. And so there are probably people here saying, probably people in the audience thinking about, I want to do better. I want to support the communities with hearing loss, or people saying, I am somebody with deafness hearing loss. I want to be supported better. So just what are some simple ways in which a person, friend, family member, support provider could just change just slightly just to make a big difference in reducing the mental health stress for people with hearing loss? So just simple ways. Where could they start first?
Yeah, I think inclusion. Following the person, their communication needs and style. Taking the time to find out what their needs are and to meet them where they are.
Thank you.
And Louise, do you have your go-tos that you'd like to share?
That's such a hard question because I guess I'm seeing so many things that could be done. And when you say what are some simple things, yeah, the perspective that people's lived experience is somehow less than or broken. I think really challenging that perspective is a good place to start. Having the skills to reflect on what might be something I'm doing that's not helpful. Yeah.
So starting first by thinking about, instead of putting it on the deaf person or the person with hearing loss, coming back and saying, is it me? Is it something that I could do, that I could change, that could be a little bit different? Because we do
Yeah.
hear from communities saying that people can be impatient and frustrated with them, but maybe stop and think, why do I feel frustrated? Can I shift something? Can I change something? Could I say something a little bit different? Like I know for me that I often talk too fast and people have to tell me to slow down, and I don't take offense at it. I stop and think, how can I best communicate with someone and to take that feedback on and meet a person where they are. So in terms of, we hear a lot about stigma and how that contributes to the mental health issues of somebody with hearing loss and deafness. Sigrid, can you talk a little bit about stigma and the way that it might present towards somebody with hearing loss and just, share your perspectives?
Yeah, I mean, there are many different stigmas or assumptions, I guess, about deaf and hard of hearing people based on that stigma, the labels that they have, and how society perceives deafness and hearing loss. And that can be internalized and have a real personal impact. Yeah, I think an example of stigma or negative assumptions are assuming a level of knowledge or a level of intelligence or education because maybe that person does experience a real education barrier, or maybe it's just a communication barrier between the professional and the deaf consumer. Maybe there's information that has been missed, like incidental learning, because the deaf person knows the information that they have access to, which is different to what hearing people have access to, the things that they can just pick up from overhearing. So assumptions about deaf people and their capacity or their abilities. And sometimes a deaf and hard of hearing person may feel in themselves that they are depressed or unworthy or not enough or that they're not functioning well. And that can be things that we impose upon ourselves as well. There are many different stigmas that can affect us quite deeply. And it's worth acknowledging and bringing that out into the open to talk about and unpack in order to change the perspectives on an individual level, yes, but also on a societal level as well. So people who work in different sectors have the opportunity to unpack those different levels of stigma, and it starts with education. Yeah.
Thank you. Louise, you mentioned a little bit about assistive technology before. Can you talk a little bit more about that and the ways that in which you can support somebody or which a practitioner can support somebody by better understanding like things, just maybe just things like captions or maybe things like hearing. A lot of times we hear that people immediately go and say, get a hearing aid and that fixes it. But no, we realize it doesn't, there isn't a one size fits all treatment for someone with hearing loss. Sometimes forcing things on them, solutions that doesn't work just exacerbates their mental health stuff. But what things should the practitioner understand about supports out there that could help somebody with hearing loss and support their well-being more?
Yeah, I think a key thing that professionals need to be aware of is that the person who is using a device is the person who decides how, when, where, and if they use that device. We have a long history in the medical profession of deciding what's good for people and then making judgments about how they have progressed or not progressed based on whether or not they followed that advice. And I think that's starting to shift. I think there's some fantastic parent groups around that are really kind of advocating for choice, control, understanding, so that individuals can make those choices over time. So yeah, I think again, it's listening to the lived experience. If something was an easy solution and worked for everyone, then everyone would do it.
Right.
People have good reasons for not doing things, and they might not make immediate sense to the person who has the advice.
Thank you. So we're going to shift a bit to some questions that have come in. Um, First one, what is the most important message we can share with people who have no understanding of deafness about the best way to support us and our needs? Sigrid, maybe if you're happy to start with that. And the question again is, what is the most important message we can share with people who have no understanding of deafness about the best way to support us and our needs?
The most important message, I think, is again, how can I try to summarize this into one message? Deaf and hard of hearing people need to acknowledge the impact that is a huge part of an individual's life. It can be a beautiful impact, it can be very rich, but at the same time, there are many barriers that come along with being deaf and hard of hearing to our health, to our mental health. It's not always smooth sailing. So understanding that there are two sides to the coin and two things can be true at the same time. There are rich benefits and also there are downsides. I think it's really important to hold space for the beautiful, wonderful things about deaf life and hard of hearing life, and also support the very real barriers and obstacles that we can face, to validate and acknowledge and do what you can to improve the systemic situation that causes those issues.
Thank you. Another question. Are there currently any Auslan translated mental health resources for deaf youth? Headspace provide current youth mental health services, but the resources are not accessible and they lack deaf awareness and impacts of language deprivation. What are your thoughts?
If you look at how much information there is for the general public compared with information available for the deaf and hard of hearing community, we have a teeny tiny amount in comparison. There is some out there, but it depends what information you're seeking and at what level and what type of information as well for what audience. Some organizations have started to bring in an interpreter to translate some of those resources. So that's one level, but the other level is to make resources that are targeted to the deaf community directly. That's an emerging space. Louise, did you want to add a bit more about, I guess, research and tools that are available?
Look, the short answer is there just aren't enough tools. I think there's some pockets of information in places. That's another problem, is that accessing what's out there is difficult even when it does exist, because things are tucked away in websites and forgotten and not updated. Again, I mean, there are some good organisations who are making efforts in those areas. Yeah, there's not enough out there.
Thank you. So there is a lot of stuff around about social interaction and its impact. Dinner table syndrome, for example, communication cycles, etc., the impact on mental health, self-esteem, development, etc. Has anyone collated any of this research?
I might jump in there. It's an area that, again, it has different impacts for people who are prelingually deaf and postlingual deafness. And so even just dinner table syndrome in those two groups has some different impacts. The research base is quite small, really. And because it's really, there's so many different experiences across the spectrum, research doesn't do well when variables aren't easily defined. So the exclusion from the dinner table setting that an older person might experience might have very different impacts than the exclusion a child might experience. So for anyone out there who's thinking about research, there's lots of gaps. Jump in. Lots of opportunities.
Sigrid, can you talk about the barriers and
If I can
gaps?
add,
So,
just if I could add a little bit, sorry.
sure, go ahead.
Yeah, the research, as you said, is limited, but there is plenty of consistency in what the research we have says. So the type of social impacts about language access, those impacts are consistent in the research that does exist, including anecdotal evidence from the communities and in research. So even though it is limited, it does say that the impact is very, very real. So yeah, the research is limited, but the issue is clear as day, that an issue does exist there. And it's important to understand that. If you're thinking about what evidence there is, maybe the evidence has some gaps because of how much it's happening and who is doing the research. So there are limitations, but that doesn't mean that the issue can be dismissed or ignored.
Thank you. Sigrid, can you talk about the barriers and gaps specific to employment?
Yeah, communication. That's really a massive one. So, in the employment space and work situations, it can be sometimes really unflexible. So, to include a deaf and hard of hearing person, to try and convince employers and businesses to offer what a deaf person needs, that can be a barrier. It's not about the deaf and hard of hearing person themselves, it's the social understanding and societal understanding of the deaf and hard of hearing world and how to navigate that and how we do navigate that. Again, there's these assumptions that we can't do things, and so that's a massive barrier. Assumptions, yeah, assumptions are a big barrier.
And if I could add to that,
Mhm.
one of another significant barrier is the education model and system. And, you know, employment outcomes are shaped by what happens from the minute you're born, what you have access to, how education can support you to achieve the sorts of things we hope everyone achieves in terms of employment and outcome as an outcome.
Thank you. I think we've got time for a few more questions, maybe one or two. What is pre and post deafness? Thank you.
I'm thinking that's a question about prelingual and postlingual. I'm not a big fan of definitions that are too strict because there's always an argument about cut-offs. But generally, prelingual deafness is people who don't have hearing that happens before they acquire a language. So, you know, from birth to maybe 10. Postlingual deafness happens after you have acquired cognitively the skills for a full language access. So that impacts literacy, and it impacts cognitive functioning and a range of things.
Thank you.
Hmm.
Inclusion is about ensuring organizations align their practices with the Disability Discrimination Act. What are your thoughts?
Can you repeat that question again, please, Jane?
Inclusion is about ensuring organizations align their practices with the Disability Discrimination Act. What are your thoughts? So should it align with the
Yeah,
disability?
I mean,
Yeah.
that's an interesting question. I think that is one level of inclusion. And yes, there is law and legislation around inclusion and what you can and can't do. And the Disability Discrimination Act is one way to encourage organisations to do specific things. But again, that's quite superficial, very surface level. Inclusion is deeper than just what is in the Discrimination Act and the tick box of saying, oh, yeah, I've done this, that, and the other, and now I'm inclusive. There's a lot more nuance, and there's more subtlety and more specificity than just that. I do think having the Act is important, but it's part of a much bigger picture of how we achieve inclusion.
Okay. Thank you. We are sort of getting to the end now. We're going into the end now. Thank you both so much for the insight and your willingness to share. As we're wrapping up, I just want to ask for final thoughts. Sigrid, what's one thing, and I'm hoping today that there were some seeds planted and people will take some stuff away. Sigrid, what's one thing you hope people will take away from today's conversation?
I think I hope that people feel more willing, more open-minded to maybe doing some of the work themselves in the professional space in the mental health sector. I hope that they are more eager to learn more and find ways to analyze themselves and think how they can work better to support and advocate for and with that deaf lens on, using that to assess how they work and what more they can do. And for people who are deaf and hard of hearing themselves and their families, I hope that they feel that they can ask their providers, the people who are around them, the support services, to become more knowledgeable, more informed about this topic.
Thank you. And Louise, what keeps you hopeful as you continue this work?
Great question, because that's where I wanted to kind of wrap up. And what keeps me hopeful is that things are changing. There is a body of literature and research that's coming from Australia, from deaf academics, deaf mental health workers, deaf mental health professionals. There is much more understanding, I think, of some of these impacts, and I do think there is a willingness for change. So I do feel hopeful, and certainly for children, I'm hoping that some of the lessons that have been recorded and researched in the last couple of decades can really implement change for deaf and hard of hearing children coming through
Thank you.
now.
Thank you so much. And again, this is the end of our webinar. A big thank to our guests, Sigrid McDonald and Dr. Louise Monroe. Thank you to our Auslan interpreters from Echo Interpreting, the captioning studio for live captions, and One Vision for their technical support. And most of all, thank you to everyone for showing up today for this conversation with your time, attention, and care. Our websites are up there if you want more information about either Deafness Forum or Macro Impact Consulting. They've got some great educational resources. I encourage you to check it out. If you'd like to provide some feedback, please scan this QR code. We always want to sort of improve and do better. And again, thank you for your time. We wish you a peaceful, connected, and meaningful rest of your day. Thank you.
Thank you.
Thank you. See you later.